Broadcasting from the campus of Salisbury University, this is WSDL Ocean City, NPR News Talk 90.7, putting Delmarva first. It's time for Delmarva Today with your host, Don Rush.
Since 2010, heroin overdoses have shot up by 95% in Maryland, and many turn to the illicit drug when prescriptions such as Oxycontin and Vicodin run out. Welcome to Delmarva Today. This is Don Rush. So in February, Governor Larry Hogan unveiled his plan for a strategy to combat the outbreak that included a task force, which will report back to him in December. Hogan noted that heroin use has only been seen as an urban problem, but not anymore. He said that local officials have told him it has become their number one problem, and he adds this is not just simply a law enforcement problem, but also a health issue. Here on the Lower Eastern Shore, Somerset County Health Department has been awarded a $152,000 grant from the Maryland Department of Health and Mental Hygiene to implement an addiction prevention program. Mady Barker is director of the behavioral health here in the county, and it also says that the drug use is affecting people who don't necessarily, fit the traditional profile. And we have her here in the studio. Welcome.
Thank you. Thank you so much for giving me the opportunity to talk with you about this important problem, this growing public health epidemic.
So describe for me this situation in terms of how serious this has become, and has this grown rapidly over the last few years, or do you get a sense that this has been stretched out over a long period of time?
This has been developing over the last 5-6 years, actually, but the reason it's gaining so much attention right now is that we are seeing an increase in the number of overdose deaths, and that's what's gaining the national, state, and local attention. We, in Somerset County, saw a period where we would experience 2 or 3 deaths a year. 2 years ago, we had 7 deaths. Last year, we had 5. We don't know this year what the numbers will be yet, but it's a small county, and it's obviously a great concern to us.
Is that because we're seeing an increasing number of folks who are using heroin and other related drugs, or is that the drug itself is becoming more potent?
It actually is due to a number of factors, and it goes back a number of years where it became very common to prescribe the prescription opiates for pain. And during that time period, larger and larger numbers of people were discovering the effects of it, and we saw an increase in the number of people who were abusing the pills. In the past few years, we've had a number of things happen that has limited their access to the prescription pills. One is that Maryland instituted a prescription drug monitoring plan, which means that doctors and pharmacies can now see if other people have prescribed the opioid medications and they in turn do not. So it has cut down on the doctor shopping. We've also had a reformulation of the pills where it's very difficult to crush them so that you can inhale them or inject them. And then the other thing that has happened is that the cost of heroin is less than the prescription drug, so people are turning to the cheaper resource.
So what is the solution to this? I mean, you have, let's first of all turn, you have a program, I think, Unmasked. Tell us a little bit about that first.
Well, our Unmasked Addiction program is to call attention to the fact that this is happening throughout our community. I'm not sure what people think the face of addiction is, but it truly is within your family, within your neighborhood, within the workforce. And what we're trying to show is that no one is born addicted, that there's a gradual process where they become addicted, and there are various points you intervene in that. And it may be the student in your classroom, it may be your coworker, it may be your son, your daughter, a spouse. It affects all of us. And we do know that 75% of the people who use heroin started out with a legitimate prescription for an opioid drug, most commonly Oxycontin. But So it's not that people start with heroin. It has progressed in their various points that you can intervene to prevent this.
Because, in fact, a few years back, we did a series on heroin addicts, and one of the things they mentioned was the fact that they initially started out using these prescriptions and moved to heroin. One of the things, though, that seems in terms of the jump is it's one thing to get, say, prescriptions from a doctor or a set of doctors, but heroin is illegal. I mean, you have to go to somebody who actually has some kind of criminal connection. How do people make that jump, especially ordinary people who would not enter the criminal system at all? I mean, in terms of criminals themselves.
Absolutely. And I can't tell you exactly where you could purchase it. I don't know that myself. But within our treatment program, people report to us that it's very easy to find on the street. And once the word is out that you're looking for it, you'll have no difficulty having someone contact you. Certainly part of this is not just the prevention and the treatment, but the enforcement's very important too. And although our grant focuses primarily on prevention and getting people into treatment, we certainly hope there'll be continued enforcement to limit the supply, because we know when people have access to the drugs, you have greater addiction. Because
one of the things I know that the governor had proposed this task force, and it's reached some mixed reviews, but one, there was a Mike Gimbel, I guess, a former drug user who was quoted by one of the local papers. And he was, as a matter of fact, a director, I guess, of Baltimore County's substance abuse program. And he said, we need long-term residential drug-free treatment in the state of Maryland. We've never had it. There are people out there who need it immediately. How do you assess the treatment side of this thing?
We certainly have gaps in our treatment system, and I can speak to what's available with our own county. We have seen a 4-fold increase in people seeking treatment for opioid addiction, most of it heroin at this point. We do know that medication-assisted treatment is the scientifically based intervention for people who suffer from opioid addiction. And the most common ones you see here are methadone and Suboxone. We do have a Suboxone program. We see people come in, engage in the program, and are able to regain their life without having the long-term treatment. But that's just one of the interventions available within the county. We also have Vivitrol, which is a newer drug that's a monthly injection that will block the effect of the opiate and reduce the cravings. So although I certainly recognize that long-term residential is one option, there are other treatment options available in the community that will allow people to reclaim their lives, reestablish relationships, gain employment, sometimes for the first time, perhaps to reclaim a profession that they have given up on because of addiction. So we need resources at all levels for treatment, not just the long-term recovery.
So in terms of, particularly in terms of resources, obviously one of the basic resources is family and relatives and friends. How significant is that in terms of getting people to get treatment, but also then allowing them to move on with their lives and put this addiction behind them?
It's absolutely critical, and we have to recognize that most people do not have that support when they enter treatment. They've severed most of those relationships, frequently because they've been stealing from family members. There may be history of incarceration. Sometimes there's violent crime associated with it. So there's a period of time where they have to rebuild that trust with family members. But with all addiction, not just heroin addiction, there has to be support within the community if the person is going to maintain that recovery. So we think it's absolutely critical that the families also engaged in the treatment, understanding what supports are needing, what boundaries need to be set, and things of that nature.
How does a former addict or someone who's trying to get drug-free, how do they repair that relationship?
It's one step at a time, one day at a time, and I know that sounds very
formulaic.
Yes. But it truly is. You can't say to a family member, I'm okay now, I need you to accept me as I am. It's letting them see that you have made changes, that you can be trusted, that you are reclaiming your life. And it's a very long process. It does not happen overnight, but we do see it happen. We see people who are 1-2 years into their recovery and have very strong family supports.
So, what do you now? Also, I guess you encourage people to bring in their old prescriptions, that kind of thing. Is that much of the problem, or is that just a small portion?
No, actually, that's a huge part of the problem. We have been able to document nationally that 70% of the abuse occurs from medications that are obtained from families and friends. So an important part of this program is to encourage people to use the drug take-back boxes that are available at all of our law enforcement offices and soon will be available in local pharmacies. We think that will get the drugs out of the home so that people do not have access to them. The other thing that we're trying to do is educate people on how to safely take and store prescription drugs. The prescription is written for you, and it's written at a dose that is safe for you. It does not mean that you should give it to your son, your daughter, your husband, your wife. It's your medication, and it is not meant to be shared. If it's written to take one a day, you take one a day. You don't take 3 a day because you think you might feel better. And as for the storage, we want people to understand that these are very powerful drugs, and they need to be stored in a locked area, a cabinet, a drawer, a safe, and out of the reach of children and pets. And of course, you don't want to leave the key around or the combination around. Right. But as I mentioned before, access and availability to these medications is really what is driving this. And if we can limit that in some way, we'll start to get a handle on it.
How much of it is in terms of, say, children who may get access to, say, their parents' drugs, for example, or is that a significant portion of the problem?
It certainly is a portion of the problem. We do know that adolescents are telling us that they are taking prescription drugs that they do not have a prescription for to experience the effect. One of the things with opiates in particular, that certain people seem to have a certain predisposition to the effects of them. And I was recently at a national conference at Atlanta where it was a very large national conference where treatment providers for opiate-dependent people had gathered. And there were stories told by various people that they took one dose and they knew they were hooked for life, that they had never experienced anything like that, and that they knew that was going to be driving them for years to come. Other people will take the prescription and say they can't stand how it feels, can't imagine why anyone would take them. So there's a very individual response to how the opioids affect us. So that's why it's so important that we keep them safely stored so that kids don't have access to them and experience that.
Let me ask you this. How much of it, in terms of addiction, how much of it is in terms of you take it for a while and then you have a withdrawal problem, as opposed to you take it and it makes you feel like a certain way, and no matter what you do, you want to regain that feeling?
Right. We feel that about 10% of the people who use the opiates will end up addicted. But you're right, there is a physical dependence that develops for anyone who uses opiates. And let me be clear, there's a tremendous value to them for people who have acute pain or recovering from surgery. And people will report that they have taken the medication exactly as prescribed for their doctor for pain, and then they say, that's it, I'm not prescribing anymore, and they will experience a mild withdrawal. That's the physical dependence, but the addiction comes with that compulsive behavior. I have to find a way to get more. I can't survive without it. So about 10% of the people who use the opioids will actually become addicted.
Now, I ran across a quote, and someone has said that we're doing well when it comes to, say, treating alcohol, marijuana, cocaine, those kinds of addictions. when it comes to the opioids, particularly OxyContin and Vicodin, not so well. Why is there that difference?
I think the difference is in the treatment interventions. Yes, we're doing well with the other substances, but I don't want to minimize the effect that those addictions also have on society. Addiction is the disease. Right now, we seem to be focused on the substance. But what we do know from the opioids is that it has a very significant effect on certain receptors in the brain. And the only way that people seem to regain that function is through some type of medication-assisted treatment that will, in a way, give mild stimulation to those receptors until a period of time when they are restored, or in some cases, people remain on medicated-assisted treatment the rest of their life. That is different from some of the other types of substances that people abuse and eventually become addicted to. There's also still some stigma around medication-assisted treatment, and even within the recovery community, there isn't complete acceptance of the fact that if you are an opioid addict and you are prescribed methadone or buprenorphine and you take it exactly as prescribed, that you are in recovery. There still seems to be some push that you need to get off the medication before you are in recovery. And I think that also interferes with people's willingness to enter into treatment and remain compliant with a treatment protocol.
If one becomes addicted to opioids, does that mean that this is going to be a lifelong issue for you, or is the body capable of putting it behind it? What do you find?
The addiction will be a lifelong issue in the sense that you have to address it throughout your life. In terms of needing to take the medication to address it, we know that some people do recover without the medication. We know some people are able to come off the medication successfully at some point. The problem is we don't know how to identify those people, and we see a tremendous incidence of relapse with people who are on methadone or on buprenorphine for a period of time and say, okay, I'm better, I want to come off of it, and they go back to using the heroin again. So we have a long ways to go in discovering exactly what the science is behind this.
And what kind of impact does this have on a community? I mean, economically and so on?
It has a tremendous impact on it. And in terms of the impact from an overdose death, which is how this actually gained the momentum it has now, for every person who dies from an overdose death, there are 10 admissions to the hospital. There are 32 admissions to the ED or contacts with the emergency department. 130 people enter addictions treatment, and 825 people have the non-medical use of the opioid. So you can see that the overdose deaths are just the tip of the iceberg. All of these others who are involved with abuse of opiates in some way have a tremendous impact on our community. The costs, it's hard to put an exact cost on, although there was a study done by Beacon earlier this year.
For about $49 million, I think.
And those costs reflect the medical costs, which I just mentioned, admissions to hospitals, visits to EDs, treatment costs. It's lost income from employment, not just yourself, but a family member who may need to be absent from work to care for you. It's the cost of incarceration for people that are in our jails and in our prisons. It just goes on and on as to what those actual costs were. It also affects our youth, that if you're living in a home where one or both parents are using substances, again, not just opiates, but that seems to be gaining the most attention right now, there's a cost to the children. There's the trauma to them of watching that, is missed days at schools, things of that nature. So, it has a tremendous cost to the community.
How do young people react to this, both in terms of addiction, that is, that they may be addicted, and seeing maybe their parents or something that they're very close to become addicted? I mean, what sense do you get about the youth there?
Um, well, in terms of who is addicted, we're seeing that it is a young population. These are people generally in their mid 20s to early 40s. So that in itself is a little different profile from some of our other people who are in treatment, where it tends to take years for the disease to develop. But in terms of the children of these people, you have to assume that they are experiencing some neglect because of the time the parents spend using, as opposed to being with them and enriching their lives and providing that strong supportive environment. In most circles, it's not something that's talked about. So there are lots of secrets within the family that mommy doesn't feel well today when she's actually lying on the couch suffering from the results of her drug use, that daddy got fired from his job, not because of drug use, but because of other factors. So there are lots of secrets within the family, and that creates a very difficult environment for children to do well in school, to feel free to go out and play with friends, because they're always worried about what may be happening at home.
Because I was going to ask you in terms of children, particularly who are growing up, how do they cope with a problem like this when they particularly see a parent? I mean, what is it? Are they resilient? Do they bounce back?
Well, we see a lot of different effects.
Yeah, right.
Some of them end up being the super achiever because they took charge and that they're going to be okay. We see different roles that children assume. Some try to distract from the issue by being the child who acts out, gets in trouble in school so that the focus isn't on mom or dad. We have others that are, kind of the clown of the family, making jokes, making light of it, again, to divert attention from it. And this is true not only in opioid addiction, but in all addiction. So that's why it's so important that we unmask the addiction, bring it out into the open so people can get the help that they need, and we don't see these residual effects in families, and particularly on our young children.
Now, one of the things I found interesting, because I grew up particularly in the 1960s, 70s, and 80s, and the thing I remember is the war on drugs. And particularly during the Reagan era and cocaine and so on, the solution was you lock people up, you punish them, and they will not they'll come out and presume that they'll be punished enough not to resume their drugs. But prison is a process. I mean, it impacts you. What do you make of the fact that the country seems now to be shifting away from this idea of incarceration? It's not just folks on the left, but you have conservatives. You see Rand Paul, for example, the senator, talking about this. What do you make of this shift in that conversation?
Well, I think what we've learned is that incarceration doesn't make people better. It may take the problem off the street for the time that they are incarcerated, but when they are released, they come back into the community, and in most cases, they're still suffering from the same disease, which is addiction. And in many instances, they don't have the help available to them at that time, so you may see them returning to previous behaviors. So I think what we're seeing is a shift to looking at our nonviolent criminals and trying to direct them to treatment facilities rather to incarceration, which is, again, a huge cost for the community. While they're incarcerated, they're also not contributing to the society in any way through employment. So I think that's why we're seeing the shift to treatment, because it just didn't work. When people are locked up, they come out pretty much at the point that they were when they were locked up.
By the way, are you concerned? I know that there was just some legislation, looks like it might get passed, to decriminalize marijuana paraphernalia, and obviously there was decriminalization of marijuana itself, so that it becomes more of a civil issue. Are you concerned at all that this will encourage people to utilize the drug, and i.e., do you view this particular drug or all those drugs as gateway drugs? What's your feeling about that? Because you've been spending a lot of time looking at this.
We have been, and quite honestly, we assume that marijuana will become legal at some point. This year, next year, we don't really know. Alcohol has been legal for many, many years, so we're looking at marijuana more from the same viewpoint we do from alcohol, that it is dangerous for some. It can be a gateway drug, but we want to identify who those high-risk individuals are that should be educated and hopefully abstain from using the marijuana if and when it becomes legal. Our youth are the number one group that we are concerned about.
So are you optimistic that you'll be able to cut down this the overdose death and the use of opioids and so on?
Well, we hope that the decline of overdose deaths from 2013 to 14 was not an anomaly, that we actually have started to make some progress. The other thing that we know saves lives is Narcan. And this is something that we want to get widely distributed throughout the community so that people who are in a position to reverse the effects of overdose can do that. We will be offering training programs to those people April 22nd, May 20th, June 17th. We will provide not only the certificate that says they are authorized to administer it, but we will give them a voucher to go get the medication for free. We have already trained large numbers of law enforcement in our community so that the more people that are in a position to reverse the effect, the fewer deaths we will have.
Well, we were speaking with Madie Barker. She's the Director of Behavioral Health in Somerset County. And we've been talking about the new program to prevent drug addiction. We appreciate you stopping by and talking with us.
Thank you so much.
This has been Delmarva Today. I'm Don Rush. Thanks for listening.
This has been Delmarva Today, a production of Delmarva Public Radio. Chris Rank produces and is our audio engineer. Don Rush is your host. For podcasts, visit our website, delmarvapublicradio.net, or subscribe to the Delmarva Today podcast in iTunes. Delmarva Today can now be seen on PAC 14. To view the schedule, visit the Daily Times or visit pac14.org.